इतना सा फर्क है कुछ होने में और बहुत कुछ होने में। इतना सा फर्क है एक बार सोच के छोड़ देने में और लग के कर दिखाने में। मान लेने में कि जिंदगी ऐसे ही कटेगी और सुबह 4 बजे उठ के सोचने में शुरुआत है। किसी मैगजीन को हाथ में लेने में और उसी मैगजीन के कवर पेज पे होने में इतना सा ही तो फर्क है। वीआईपी सीट में और उसकी पिछली सीट में इतना सा ही तो फर्क है। वो जिसका मैदान ही खुला आसमान है वही कल जमीन पर तो था। पूछोगे तो बताएगा वो पंछी। ये एक दायरे में सिमटने में और पूरी दुनिया को दायरा बनाने में बस इतना सा फर्क है। इतना कितना है? इतना है या इतना है? जो नापेगा वो जाने कि जहां धरती और आसमान मिलते हैं, नानकुर से दूर, अगर मगर शायद से दूर, वहां भी दोनों में फर्क बस इतना सा है। धरती और 7वें आसमान में फर्क बस इतना सा है। ये एक अंतर प्रेरणा है। ये हमारी, आपकी, हम सब की अंतर प्रेरणा है। एक कदम, एक छलांग, एक बाजी, एक गहरी सांस और एक ललकार खुली हवाओं में कि हाँ मैं बना हूं उन फिजाओं के लिए, कि हाँ मैं बना हूं उन ऊंचाइयों के लिए जो ऊंची तो बहुत है पर नामुमकिन भी नहीं, क्योंकि मुमकिन और नामुमकिन में बस इतना सा फर्क है। धूप छांव में फर्क बस इतना सा है। तो बस चलिए फ्रेंचाइज इंडिया के साथ ये फर्क मिटा देते हैं। फ्रेंचाइज इंडिया।
Good afternoon, everyone. A warm welcome to our Business Opportunity with Chai webinar series. This is a launch webinar of Business Opportunity which Franchise India team is launching today. It's a 45-minute session. We started with the presentation from brand side. They'll be talking about their business model as well as financial model. Moving towards our panel discussion, we would love to take all your queries. We have created a question and answer box for all the investors and friends, those who have joined us today. Please do share your suggestion, feedback in the same. The particular webinar is hosted by management team of Franchise India, Gaurav Sir and Sonia ma'am. I welcome Sanjay Bhatt also, who is leading the IFC vertical for us and a very, very senior resource in the company. And the business opportunity we are launching today is PhysiQure. They are inviting the franchisee partners as well as Physio associates. This is your chance to start your physiotherapy center and earn 21 to 38 lakhs annually. PhysiQure is the most trusted chain of the physiotherapy chains. They are successfully running 6 company-operated centers in MP. They are passionate about providing the professional, trustworthy, and effective preventive treatment experience to all the investors. But what about the business opportunity and model? For that, I invite Anubhaji as well as Anandji, both part of PhysiQure team. Anubhaji, she's the CEO at PhysiQure, as well as Anandji, he is the advisor. Thank you so much, Anubhaji. Thank you so much, Anandji, for joining in today. It is our privilege that we are launching you on this particular webinar. So over to you. Without taking further time, we invite you to talk about your business model. Thank you.
A very good afternoon, everyone. I'm Anubha Singhe, founder and director of PhysiQure chain of advanced physiotherapy clinics. And I take this privilege and honor on behalf of PhysiQure as we celebrate PhysiQure's 2 years on World Physiotherapy Day. That was yesterday on 8th of October. Before we start talking about PhysiQure, let me just give you a glimpse of physiotherapy. Physiotherapy is an art and science that has been since years together. And basically, it is a clinical branch of treatment. We treat not by medicines, not by surgery, but by physical means. And it is based on one-on-one assessment, which forms the core value of physiotherapy. Next, please. Okay, about PhysiQure. PhysiQure was started with our experience of 15 years. Me and Anand have around 15 years of experience in physiotherapy. So it was started with the aim of providing the best experience in physiotherapy, standardized protocols, quality treatment, because we believe that the approach of treatment should be affordable and approachable by all. So we are a team which is passionate about the trustworthy, professional, effective forms of treatment. Physiotherapy is effective not only in the treatment part, but also in the preventive injuries, supportive form like geriatrics. It is supportive in all forms. We wish to reduce the total cost so that it's not very expensive, but still the patient can get the best of the best. Now we are ready with treating more than 1,600 patients over a span of 2 years. Now we are ready to expand, of course, with the support and guidance of all of you. We started on 8th of September 2020. Despite COVID, we started with 4 clinics in Bhopal, finally progressing to Sagar and Mandideep. Now we are a team of 25 physios with different specialities, different experience, qualifications, but a very, very strong team, able to manage the basic pain factors to the tertiary rehabilitation, like the post-operative rehabilitation, advanced neuro rehabilitation, and of course, we're also running our telehealth services. We plan to include a physiotherapy college, an upcoming neuro rehab 100-bedded hospital, and corporate plans. We are also proud owners of Physio Times magazine, which is India's first and leading physiotherapy magazine, with more than 15,000 physios overall India connected with us. So we see ourselves as physiotherapy evangelists. Next, please. And we are unstoppable. So future projects are insights of having a physiotherapy college, because as we talk about quality care, it starts from the base. If the physios are qualified, we will make them the best. Apart from that, we are ready we are almost ready with the upcoming 100-bedded rehabilitation hospital, which is one of its kind. The patients of all over India can benefit, because rehabilitation requires complete focus, and we believe in that. Apart from that, geriatric rehabilitation is also the need of the hour, and we are in the direction of working in that. Next, please. What has made us so passionate about PhysiQure is that many of the clinics, or the centers as we call across India, lack these expertise, like the modalities or the machines are not up to the mark. It is uncollaborated with the patient, does not understand, but it obviously affects the quality of treatment. The misleading diagnosis, ineffective care, overall follow-ups, giving value to the patient's opinion, his feedbacks. These are things which were unmatchable earlier, but we were always focused, and we are focused about managing all these things. Next, please. Now, what we look forward to. With franchise and company-owned clinics, we wish to focus on our plans, which are standardized protocols, improving the knowledge and education of all our teammates and not restricting ourselves to any limit, not compromising with the quality care on any part, education of the physios on a continuous, very good basis, and of course, ensuring that the quality doesn't fall at any place. So overall, we can say that we are working on the effective, cost-effective, and treatment-effective model overall. We provide basic care like the primary care to the tertiary physiotherapy care. So we have these packages as we go, like Flexit. If there's a lot of patients nowadays face these musculoskeletal flexibility problems because of the work nature, we are there working on the Flexit package. Stronger spine, much needed for the younger generation and the older generation. So we are working on the strong spine. These are our modules which we have made, which are very, very specific for the type of problems people are facing and the type of treatment that we'll be offering. Baby steps include a pediatric rehabilitation model. Back to life is the post-COVID and cardiac surgery patients that can be assisted, and a lot benefits can be gained through physiotherapy. Flexible joints, 60 to 70% people have that problems of joints, and where we can help, we are definitely using this module. Healthy lungs and heart, and holding hands. We are also into maintenance phase. Some conditions cannot be treated through any means, but we are always there for them, and we believe in community building. Next, please. So, as I just said, it's more than 1,600 patients till date, many emotions, but only one voice, that physiotherapy really helps. And when we talk of physiotherapy, it is synonymous with PhysiQure, because at PhysiQure, we care to cure. The team involves myself, having 15 years of experience in academic and clinicals, along with our technical head, Satiji Anand, who is the advisor, Dr. Nilesh Theresa, who is a startup mentor, and Akanshji and Ankurji, who has been with us since day one. Now I hand over to Anand to carry on. Thank you.
Thanks, Anubha. Thanks, Franchise India, for this opportunity to share our thoughts and going ahead with the expansion plans, and not only expansion plan, but going to deliver something really incredible for the Indian community and Indian healthcare system, that is physiotherapy, which is a greenfield. Before I go ahead, I would like to share a glimpse of our centers, that how does it look like, what are the things that we follow. A short video about our clinics. Thank you very much. This was a short video stating our interiors and the kind of centers that we developed, which is a company owned, and we are focusing on giving a standard and ambient atmosphere and an experience, treatment experience to the patient for Pan India. That is the main motivation for the PhysiQure, and not only limited to the ambience only, but also a quality care. If we'll talk about the industry of physiotherapy in India, right now, this is the condition, this is a part of medical science which is growing with a 12% CAGR, and it is really exponentially growing. Why is it so? Because of the common sports injuries, because of the sedentary lifestyle, because of the lifestyle disorders, stroke, paralysis. If I can say, each and every family is having a patient, or each and every family is having a need of physiotherapy. Either you can talk about curative, but also in preventive or supportive way also. As we can, the stats that we focus right now is around 15,000 crore revenues and all these things in 2020, and we are hoping for 27,000 crore of business in physiotherapy in India by 2025. So this is the main rise in demand because of the rehabilitation care, and apart from that, awareness that is spreading right now. So what we are going to do, before going ahead with the franchise model, let me say that we are there for the 360-degree support. How come? We are going to handhold from recruitment to the patient experience and quality assurance of your clinic. Our model is on two types, PhysiQure Lite and PhysiQure Advanced. For PhysiQure Lite, you require a space of 400 to 500 square feet, around 600 square feet space. And with the investment of 10 lakh rupees, definitely you can start your own physiotherapy center. And we are going to provide you professional staff, legal licensing, all the things related to start that particular clinic. If you are willing forward to have a center of, a talk of a town, and a center which is specialized with robotics and which is specialized with specific equipments and advanced equipment, then definitely you can go ahead with the PhysiQure Advanced, which is costing for 30 lakh rupees, and the space required is around 1,000 square feet. And in this condition, if I'll say in a primary model, we can definitely care for 70 to 80% of clinical condition in a very well manner. While we go, if we want to go for the specialized care, like care of paralysis, like care of, severe back pains and all these things, that can be covered easily in advanced model. And the payback period is quite awesome. These data is not based on some assumption. These data are based on our own experience from last 2 years. In 2020, PhysiQure got the seed fund in January. We started our operation in September 2020. We could have started the franchisee from day one, but it was not there. Why is it so? Because we want to learn each and everything, and we want to experience all the metrics that we are thinking, and that should be converted into reality. So we waited for 2 years, and after 2 years, with the help of Franchise India, we are very thankful to Franchise India to have us with them, and we are going ahead with the pan-India expansion to build a trust, to say whatever we are going to do is really we did that, and we are going to convert it in a same model with each and every city. What are our value proposition? Our value proposition, definitely, we are not going to have random franchisee. We are going to have a feasibility assessment and location survey. On the basis of that feasibility assessment and location survey, we can definitely tell to our client or the franchise or investor that that location is meant for the clinic or not. And if it is meant for clinic, then what should be the strategy of coming 6 months? So we can make that particular center sustainable, self-operating. This is the main purpose. So by assessing this feasibility survey, you can take your call that you want to invest or not, and we can take a call that we want to go for that location or not. So this is the first point of trust that we are developing. We are not just there to sell the franchise. We are not the seller. We are just trying to have a presence and a centers which should be sustainable for years long. After the feasibility survey, we are going to develop the facility with design, proper equipment purchases, installation, final clearance, and then licensing and legal support. We are going to recruit the staff, and those staffs will be recruited, trained, monitored, and replaced by us. So even a person who is not from a medical background and looking forward for a medical venture via physiotherapy, definitely PhysiQure is really a great choice, because entire operations, entire support is from our side. Training and development is a continuous process. Medical science is a field which is dynamic, and it require continuous support. So training and development is always there, because whatever the physios that learn today, that need to be upgraded with time, and that upgradation will be from our side by identifying the new technologies, new techniques, and then after that training that and passing that knowledge to the appointed physios. Patient information and relationship management is a crucial part, because whoever the cases that is coming to your clinic that need to be managed, that need to be pampered, or that need to be taken care very well. So PhysiQure backend office will be taking care of those patients in a very well manner, whether they are satisfied. If they are not satisfied, then what else can be done to make them satisfied and to solve their queries. Access of expert and expert supervision and operation. In last 15 years of our experience, what we observed that standard operating procedures for the physiotherapy setups and for is essential. And in last 5 years, we developed those SOPs in a very well manner, not in terms of clinical, but also in terms of patient experience. Equipment and maintenance care, generally people do avoid the calibration of machines, and that results in a bad outcomes in terms of treatment and all. We are going to manage that particular part. Calibrated machine, every 6 month calibrated machine will definitely yield better result rather than some machines which are neglected or which are there for years or something like that. Apart from that, we are going to have a brand ambassador and a central marketing and all the kind of support that is essential to run your clinic very well. What we are looking forward as a partnership ethos, whenever it is come to the ethical part, definitely we want a transparency in operation from our side. Definitely whatever we are saying, we are going to deliver the same. We are the believer in process, and we believe that whoever is coming, they are also a believer of process, because once we follow the structured process, definitely success is there. So this is a main point that we need. Continuous learning and improvement is a part from the franchise side also and from our side also. Whatever the things that went wrong that need to be corrected, and that should be corrected in a due course. So this is the reason we are always into continuous learning and nurturing trust and respect. These are the two parts which is there for a vice versa from the franchise side and from our side. So we can see, once again, I'm going to tell that we don't need to sell franchise. We are looking forward for the partners, those who are sharing the similar passion of healthcare as we are having. What is the ideal partner profile? If a person is from the healthcare background, very good. If it is not, then it is also not an issue. Access to the capital, potential, and multiple location. If nutshell, if I'll say, we need three major things: space, investment, and local support. These are the three things that we require from the ideal partner. The rest of the things will be done by PhysiQure and very well managed by the PhysiQure. This is the FOFO model that we are coming up. Means the brand guideline and the operating SOP will be from our side, and which is mandatory to follow because we developed those brand guideline and SOP with lots of labor and pain. And if that can be followed, that will be followed, then definitely that is going to bring the success to the venture, to your center, and to definitely to the PhysiQure. Clinic ownership will be with the franchise, investment is from franchise, revenue will be collected by the franchise, and apart from that, operating expenses will be from the franchise. We are going to charge a royalty of 10% for the continuous support. 90% is there with the franchise, so they can manage their operating expenses and all things. And we are going to give an exclusive territorial right of 5-kilometer radius. So whatever the activities that is planned related to the physiotherapy in 5-kilometer radius will be owned or will be governed by that particular franchise. This is the main franchise key roles and responsibilities, which is right now in front of you. That initiation phase, definitely you need to fund and participate in initial feasibility report. Then you can take decision and move ahead with the agreed model, with the legal terms and all these things. We will be providing template guidance and go for the reports, and then legal documentation, legal contracting, then setup. During setup, you just need to provide an infrastructure, which is a 4-wall and a painted its interior will be done by as per our guideline, provided the organization structure, team information, and complete know-how will be done from our side. So day-to-day operation, definitely, if you can have a supervision to the clinic, that will be awesome. If you are not having enough time to supervise a clinic, and you can give a weekly 1 hour or 2 hour, that is also sufficient to operate such venture, because each and every case will be monitored by PhysiQure through our own internal technology. As Anubha said, that we are having our own technology team in-house, and our technology is built in such a way to monitor the quality assurance of each and every center, and the entire process is designed in such a way that each and every patient will be monitored by the central team. IT infrastructure is from our side. Performance and review planning is the common thing that we need to do, and R&D and innovation, we are always ahead in R&D and innovation to provide the optimum care to the patient. This is our expansion plan. We are looking forward for these cities, not only limited to these cities, but we are looking forward for any location in Pan India. Any location, I would like to say again, any location in Pan India, wherever the feasibility survey is coming better. So we are open for Pan India, Maharashtra, Chhattisgarh, even for the South, even for the West, even for the East, anywhere, because we are on basis of technology, we can deliver our commitments very well. So this is all together about PhysiQure. Once again, if I need to summarize for the PhysiQure, definitely we are looking forward for a channel. We are looking for the franchise partner, or you can say a partner to the PhysiQures, those who are having a vision to start healthcare venture via physiotherapy, and they want to excel, and not only in terms of get a monetary benefit, but also in terms of a healthcare service to the society and a respectable profession of healthcare. If they want to opt to gain the more respect in the society, PhysiQure is a way through which they can heal a lot of people. Thank you. This is Anand Singh from PhysiQure signing off. Over to Franchise India.
Hi, thank you very much, Anandji. It is much elaborated way. You have already given us understanding, and I would definitely congratulate you and your team for doing such a wonderful job, because we believe that physiotherapy is not about the exercise. So just one question from my side. That's the first question my audience is also asking. as you have already said, that the profiling of that franchisee is not important. That should be from the same background.
Right.
So how is it important for you to take, if he is not from the same background, how he or she can add value then for your business?
Right. See, local support is always required. If they can supervise the center, definitely that is an add-on value. If they can go ahead with local, connect, a social connect in their area, that will be a value addition. If a person is having a good community nearby, that will be an add-on value. If a person, even though, once again, our marketing strategy is in such a way that within 6 months, we need to build a community of 1500 people within 6 months. And this community definitely going to be a rotation for the patient. So if the person is adding some value, that will be help to us. हमें थोड़ा सा पसीना कम बहाना पड़ेगा, लेकिन सारी चीजें हमारी तरफ से.
Absolutely, because at this initial stage, it's very, very important when somebody joins you, non-background person, then your exercise goes little more into this, because then how equipped we are, how team is ready for that. Because if now, since we are looking for pan-India,
right,
and if first franchisee is coming out of your territory and it comes from the north side,
right,
then it's very, very challenging for you also, for your team, to
right,
go and service that franchisee.
right.
So in that regard, how is training being built as a team, as a system in your organization?
Right. The first phase is a feasibility phase, which is meant for a survey. That feasibility is not only for saying yes or no for the clinic. That feasibility survey includes multiple parameters, from the competition analysis to price band to education level to awareness level of that particular community. And that particular lots of questionnaire is there, sample surveys will be there, which will be conducted in 2 or 3 days time. Based on that survey, we can come across with the 6-month strategy that what need to be done for that area. According to that, marketing kit and marketing strategy will be planned individually for that particular center. We will be providing marketing kit, we will be providing marketing strategy, communication to the franchise. Now we just need that franchise owner should distribute that in a prescribed format, and the things will be done very easily. And the technology is there. Our each and every center is monitored by our technology. So whenever a patient is coming to that particular clinic, suppose that, and apart from that, physiotherapy is having different type of specialization like neurology, orthopedic, gynec, sports. These are the specialization which is in physiotherapy. So what will happen if a case is coming to a clinic is of neurology and a physio appointed over there is expert in ortho? Now that is a stucking phase. So during that time, with the help of our telehealth and technology, that physio can take help of our central team, and definitely central team can help that particular case and can help in a proper care. That is what. So every structure. That's why, sir, Sanjay sir, I told you कि हम लोग 2020 में franchise इसलिए नहीं start किया था. We are starting franchise after 2 years of entire deep research, process development, and right now we are. Hello, am I audible?
Yeah, absolutely there. Now, absolutely there. Yeah.
So,
please go ahead. Yeah, that's true. I think that's what you have set the base right, because 2 years R&D is very, very important, because any business, when you go and expand and you are looking for now taking new people as your partners, so it is very important that first you are trained, and then your system is completely working and it is proven, because any franchisee would join you if your business is proven and your track record is okay, you have seen your ROI is already there, break even is already there. That's very, very important from the franchisee perspective, because I believe as per the investment is concerned, it can be 5 lakh also or 5 crore also, but it's already important how I am getting the return on investment back. And then what is my break-even period? So in that regard also, my next question would remain, how different is your clinic from any other regular physiotherapy clinics? Because there are a lot of physiotherapy clinics around. Every city we can see there are a lot of physiotherapy clinics. In fact, if I talk about myself, so in my neighborhood also there is a physiotherapy clinic. So how different we are from these physiotherapy groups?
Sir, I would like to answer this question in a very gentle manner, that each and every professional is unique. Each and every professional have done their work very well. Each and every professional is doing with full dedication. So comparison should not be there. But I'll say that if someone is coming to PhysiQure, they should feel the experience of PhysiQure. They should be with PhysiQure. They should not compare with any other place. If they are satisfied with us, they will be our client and they will remain our client for always. So comparison, I would like to avoid, because I respect each and every professional in that manner, and each and every professional is doing great. But our processes and the corporate structure is meant in such a way which is infusing business to the profession. And if we are following the strategy of management, business, and all these things in a profession, definitely the growth of profession will be higher.
Absolutely. I think that is the right answer to everyone, because everyone is unique. They are doing their best. You are doing your best. There are a lot of questions now in my question Q&A box also. So one question says that franchise should be physiotherapist, which you have already answered to this, that it's not important. But if he is from the same background, would really add value. But it's not important that you should come from the same background also. So you have complete confidence in your system that you will train him. You will make him the physiotherapist, right?
No. We are not going to make a non-physio to physio.
Okay.
We are going to appoint physio for that center, and that physio will be taking care of that clinic. Franchise owner will be the owner of clinic. The people, those who are the professional, will be appointed, because it's a medical science. The legal licenses is not possible to the non-physio. So physio will be appointed from our side, appointed, monitored, trained, replaced, and each and everything will be from our side.
Correct. So another question was, there any license required? So that would mean that franchisee owner do not require any licensee for this, because you will be they
require license, and that licensing will be done by from our side, because each and every health is a state matter. Each and every state is having different health policies. Like in our Madhya Pradesh, the CMHO license is required, and the physio need to be registered in a council. Maharashtra, there is a council, physio need to be registered with that particular council. So we are taking care of all legal licensing and structure. Beyond बिना licenses के हम कुछ भी नहीं करेंगे. Licensing is our part. We are going to do and facilitate that particular part.
Absolutely. And is there any preference of location also, wherein you feel like?
Yes, that basic guideline that we are following is around 5 kilometer radius with 1 lakh population. If this is fulfilled, we can definitely see in 1 lakh population, we are assuming 20,000 families. In 20,000 family, rule of 10% that management says, if we can develop a community of 1,500 to 2,000 people, our rotation is, our clinic will be in auto mode. So this is a simple formulas that we are following, and we are going to achieve it very well.
Okay, and it can be open in the commercial area, or it is the residential area?
Residential area can be done. Health activities can be done in a residential activity. Absolutely. But once again, that will be a feasibility, because if that state is not allowing, then that will be a trouble. But that will be done in a first phase. So right now the franchising process, Sanjay sir, if I'm going to divide, right now we are in a knowledge phase. So if any prospect want to learn about franchise, that what it is, this is in knowledge phase. Once he learn about, okay, fine, this is a good model, I want to go ahead. I'm not going to ask for the entire investment in day one. I'm just going to ask for the feasibility. Feasibility, once the feasibility report is there, then definitely we too can sit in front and definitely take a call whether we want to go ahead or not. So the entire investment is secured. If feasibility report saying yes, we can do it, we will definitely do it.
Great. Next question says, what will be the customer acquisition cost and customer retention cost?
Right. That you can say, if we are following the structured way. So this question is much more valuable in a product based. In this particular segment, if I say my statistics, so my customer acquisition is coming around 457 rupees per customer, while the single person is giving me on an average of 4,000 rupees on an average, I'm saying. So the customer acquisition cost, if I'll say, if I want to generate lead and the conversion ratio and all these things I'll compare, that my statistic is showing. But once again, demography will definitely vary, and this stats may vary.
Okay, very helpful. Physiotherapists are to be on payroll or need to be paid on case-to-case basis. I think you have already answered that, but they want to learn more on this.
Physiotherapy will be on payroll. Physiotherapists will be on payroll.
And this will be taken care by brand.
Franchise. They should be taken care by franchisee, but their training, their monitoring, their entire thing will be done from our side.
Okay, so cost will go to the franchisee.
Cost will go to the franchise.
Also, what is the minimum resources in terms of manpower that would be needed to maintain the center? So overall clinic, how is the manpower?
For a small clinic, we are going for the 2 physios, initial level, and for this advanced one multitasking worker and 2 physios. Why 2 physios? Because this entire business, this entire work is based on the manpower versus revenue. So once the number of patient is there, our statistic is for 15 to 16 patient, approximately maximum 20, but we are taking a upper threshold with 15 patient. Once we reach the 15 patient value, we are going to hire another physio, because this will be going parallel. Number of physios, number of patient. 1 physio is equal to 8 to 10 patient. That is sufficient. Okay,
great. So preference of location, it will be rented or it is the ownership based. But I think
if it is a ownership based, it is really very well. If it is a rented one, then definitely that can be considered. But my specific suggestion is that to choose that space which you can hold for 5 years, because continuous shifting, frequent shifting of the place is a problem in this, because healthcare is all about trust. So once you will develop a trust and you will change the location, then definitely that will be a little trouble.
Absolutely. And I think ground floor, first floor, second floor preference.
Ground floor is always there. First point, if it is in a different floor, then definitely lift is required.
Maybe elderly people will get some problems.
Well, wheelchair problem, elderly patient with a pain, they are not able to climb with the stairs and all.
Absolutely. And somebody who is visiting your clinic is already in the pain.
Right.
We don't want to give him extra pain. Yeah. All right. So somebody is saying that cities which are mentioned in the list. So can we go for the smaller cities also, smaller towns also?
Yes. Actually,
I think wherever consumer is there, our requirement is there.
We can definitely go. And apart from that, the city that was mentioned in the list, it is just because of the limitation of the space in slide. So I just mentioned in that way that any city which is having a 5-kilometer radius, a population of 1 lakh, that is ideally suitable for our clinic.
All right, that's great. And now my next question is Anubaji, if you can just answer this. So if you see the paralysis recovery, spine health, there are knee recoveries which are required, knee joints and all, maybe shoulder. So there are a lot of areas, because it is we talk about physio. So it can go with any part of the body, right? It can be cardio, it can be anything. So how is it that we are, having the treatment for all these things? And how big should be the center also, because you need to have all these resources available then there.
So basically what happens is at the bachelor's level, the physios are qualified and trained enough to tackle all sort of patients. It's not that in the bachelor's, which is a 4.5 years degree course, they cannot see an ortho patient or a neuro patient. They are qualified to see all type of patients, but then if we have specializations, according to that, that is a better guidance. That may also come with experience. So a bachelor person, a BPT physio, but then with experience of 5 years or 4 years can also have that experience qualification, what we say. And then we are there, like the core team of PhysiQure has the specialist of all sorts. So we'll be always the hand holding, we'll be guiding the persons there to the physios there to take care of the patients in initial phase and develop the protocols. And the space required, so basically we need the basic space. That is what we have mentioned, the 500 and 1000 square feet. That's the basic. We can manage a cardio patient also there. We can manage a neuro patients also there. Some a little bigger, wider, better, but it's not a limitation. basic space required is enough to tackle all sort of patients.
I would like to add on in that, Sanjay sir, that the basic light clinic that we are offering is going to help with the 70 to 80% cases. 72. But if we want to go for the specialized clinic like robotic, like specifically recovery in paralysis, maintenance of, the chronic back pains, the osteopathic, the chiro clinics and all these things that require a little advanced one, which is an advanced model. But I always suggest if a person is going ahead, they can start with the light and they can convert it into advanced in the coming time as the things are going well. So these both options are open. If someone are really looking for the talk of the town or, the best center in the town or something like that, they can definitely go for the advanced from day one.
So would be there any cost difference for service to service, location to location as well?
Yes, cost, the price band for the customer will be different. Just I'm going to say the metrics in that way. If a price band of 500 is there, then we need 12 to 13 patients to get all the things done, right? If a price band of 200 is there, so we need 25 cases, and which is very possible. See, if the price band of some location is 200 and we are mentioning 500, just for an example, we are not going to succeed because the price in India, culture and price, these two things are always in a business. So price, you need to consider as per the demography, but you can enhance the number of visits, different type of packages. These marketing strategies are very well thought, rehearsed, practiced by PhysiQure, because we run the centers in a tier 2 or tier 3 cities also, and in Bhopal also. So these things are clearly mentioned and clearly taken care by PhysiQure with their strategies.
Very helpful. So where's the location for rehab hospital?
That is in Sagar, Madhya Pradesh.
This is already in Madhya Pradesh.
Yes.
Okay. And if you can, I believe we should throw some light also on the commercial models, the financials again.
Yes.
So that it should be a little more clear to all our investors.
Sure. I'm just
or
going to
my
share,
partners. Yeah.
Right. Sure. I'm just going to share the screen once again. Can you see my screen right now? Yeah. So here is the financial model that is with us. If we talk about the investment, that is for the basic clinic, it is coming around interior fit out is in 10 lakh rupees. It is coming with interior fit out, medical equipment, licenses, franchise fees, signage, and all these things. This is coming around 10 lakh 60,000. We are rounding off in 10 lakh. And for the 1,000 square feet, it is coming around 29 lakhs rupees, something like that, which is rounding means 29-30 lakh rupees, because the franchise fees is fixed somehow. Medical equipment, whatever we are going to buy, that medical equipment will be invoiced in your name. So definitely that will be up and down rahega. So this is the one thing. It will go for the franchise, this CMA model. The initial 3 months we are taking as a gestation period, and we are assuming that after this, in this gestation period, we are not having that much footfall. So an average of 2 patients a day for the initial 3 months. And then after that, we are assuming 12, 13 and coming up with a 14 patient and a price band also. Once again, the price band mentioned over here is generic, which will be changing as per the location, which will come in a feasibility report. And this feasibility report will be based on like living index is there. So what type of physio can be appointed? What will be the cost to the physio? Everything will be coming in that particular feasibility index. It will talk about this second revenue model, which is for the advanced clinic. Here it is. We are taking as a 5 or 6 patient in an initial stage. Why we are taking for the 2 in the light and 5 over here? Because it itself is a marketing brand, because this clinic itself is a experience clinic in which everything is of ultra modern equipments and all these things. So we are hoping for the better patients in the initial stage, and the price band is definitely higher in this one. But once again, this all depends on the feasibility. So if you can see this cost and or everything, if I'll go for this particular clinic, 500 square feet, the revenue, the payback period is coming around 26 months. That is coming in. We are taking care of CAGR. We are taking care of increment. We are taking care of royalty. We are taking care of consumable. We are taking care of incentives to the physios and everything. So each and everything has been taken care during these sheets. But once again, I would like to say that these numbers are numbers. Once we go for the reality, once we will go for the, the exact location, exact geography, exact place, definitely the real reality, real report will come out from there. So I generally, I'm little hesitant in this particular part. Why? Because once the person can understand the basic model, they should approach us for the feasibility report. Once the feasibility report is there, then they can talk, and we will be very confident for the numbers, that these numbers are there and this number we are going to achieve at any cost, because this location is telling that story.
Absolutely. So Anubhaji, anything you want to add to this as per your experience?
Yes, sir. So it's basically that patient to patient, it may vary. Neurological conditions need a little more of extensive treatment. So the cost, the charges, it may go to a little bit higher side, but we also provide the quality care for that case. So it may vary, and that is perfect because we need to have explore the area. It is very, I would say, customized. Location to location, like we are running here at the 4 clinics in Bhopal, the basic structure is same, but still the type of number of patients, the type of quality type of patients, neurological, generalized pain patients, it varies, but the best output it is received in that area. That is our aim.
And one last thing that I would like to tell, whenever we say ourselves as a cost effective, it
Right.
doesn't mean that per session cost is less, but number of session required and the cost, if we multiply that, if suppose someone is going to be treated in 50 sessions, and if we can treat him in 15 sessions, then definitely we are cost effective very well. So this is the difference that we are quoting, and we are cost effective for sure, because we are caring in not in terms of, the let it be care. We are there because we care to cure.
Absolutely. Care to cure is very nice. And I think you are so dedicated into this. So if I talk about out of 6 centers, do we have any franchise center right now?
Right now,
Other
not
question
there.
which I got.
No, not there. 6 company-owned center is there, but we are just going to close 12 deals in Madhya Pradesh. So that is a really great one. So by the end of, you can say, September or October 1st, we will be having approx 20 centers in Madhya Pradesh and the nearby areas.
These will be all franchise stores?
Yeah, it will be franchise. Through Franchise India only. You are there. You are there.
Most likely. Absolutely. Absolutely. And if you're talking about non-performing center right now, which is company owned right now, so you want to discuss anything about that? How much time it has taken up to that level?
Yes. We had there. Once again, that is because of the bad feasibility. Once again, so our initial days, we had that experience also, and because of that particular experience, we were evolved, and we have taken a certain protocols in our feasibilities and all these things, and we are not going to repeat it anymore.
Absolutely, and that's your experience says. So, Anubaji, one question to you: being a women entrepreneur, so how are you now supporting women entrepreneurs to join you as a partner?
So we amongst 25 physios, we have almost 18 are women. So it is basically the physiotherapy field is basically women oriented, and I feel women are more passionate and more focused in treatment. As like if we talk about our patients, no, we are not limited to till the time they are coming to our clinic. If they are enrolling in a 10 sessions package, we are not limited to that 10 sessions and then we have know about them. No. So we are targeting the overall. Even our feedback systems are developed in a way that after every 15 days, there's a call to the patient to know how is he progressing, what is the current state, and we are asking them to come for follow-ups and know more. So for all this team, I'm really very happy that my team, which is mainly of women, is very happy, very effective, and very target oriented.
So is there any special scheme, special focus on women entrepreneurship? Because from women, what I'm saying is maybe someone who is not financially capable right now, but experience wise or passion wise, they are ready to join. So anything from your side for them special, anything?
So of course, we are building this women, what we call as PhysiQure's women's health community. Okay. Where we are much into the corporate, this community awareness. We want every woman, maybe it's a housewife or the teachers or the mothers of kids, we want all of them to be connected with us with all sorts of means. If they're not able to visit on regular basis, we at least want them to be in touch and follow-ups. every time to time, so that on telehealth, on other things, so people can join, women can definitely help us out in this community building, women to women that connect.
I would like to add on in this particular part, sir. We are already having some MOUs with banks. If someone is not financially, suppose there is some trouble in arranging the initial funds, the bank can finance this entire model. Bank can finance the entire model. So definitely that is also there. And we are having a direct tie-up with the banks. So need not to that franchise prospect need not to go to the bank directly. They can just submit the document to us and we are going to facilitate the entire process.
But that's good news, and I think I would also add Franchise India also have taken one initiative wherein in this regard we also have got one of the division wherein we also have taken this thing that we should also help them. So we have one of the division who would definitely work accordingly. So I would request all my partners, all my channels, system, and everybody who is there. If you have any case like that, so we will also support in that regard, because we don't want anyone who is having passion and having a right profile should not leave this opportunity because of the financials. So if there is any passion, it should come forward and we should definitely support. At Franchise India, we also have always tried to give that kind of opportunity, create that opportunity for everybody. If your passion is there, if your liking is there, if you have some kind of interest in that business, because if you are interested, if you have that intent right, and you have interest, you have that passion, I'm sure brand always would pull that and help that to take it to the next level, because it is all about partnerships. So partnerships is mutual, growth is mutual. And as a brand, I think now at this initial stage, you also are looking forward for like-minded people to join you. So we will request all our investors who have joined today, all our partners who are there to in between helping all the investors to understand this opportunity. They should promote this, and they should definitely go next level and take these like-minded people, passionate people further to join the brand. And because since you have given 2 years to this business to understand from the basic that how you want to make every partner grow, because then if you are, it's not about franchise development and making more partners. It's all about making every partner grow, and that is what intention and idea at Franchise India we look at. We want every partner to grow, and I think you also have put this thing rightly forward, that you want every partner to grow with you, because it's a long-term and lifetime opportunity for them as well. So congratulations for that, and I think Anubaji heading this, I believe this creates a lot of confidence and a lot of trust also across, which gives a lot of confidence for getting into the system as a partner with you. So if you can give us little more now as a last comments from your side, that how you would help in terms of building up the local market, because that's very important, because joining, at the time of joining, you invest, but then we have to show that path wherein you make him grow, and that is all about marketing, that's all about brand building, because we are at a startup level. It is, if you are going for a new city, new region, then it is very difficult to have a competition is already there to compete with existing physiotherapy clinics. So how you will add, because I'm also thinking from a perspective that I'm tomorrow starting my physiotherapy center. So from that perspective, how I would grow my market, and my consumer should come to me, because I'm depending on consumer. So more consumers would mean easy break even. So then I'm successful. So please throw some light on this, then we will take the rest of the info.
That is really very important question and a point of concern from the investor side, because definitely they say that, okay, fine, central marketing you will do. That how I will do the local marketing. Absolutely. Let me take this platform as an opportunity to announce that for initial 25 franchisee, we are going to reinvest the franchise fees to them only by appointing a local executive and going to guide. Our central marketing team is going to guide, and for 6 months, we are going to make that clinic self-sustainable for sure. We don't want to earn any money from initial franchisees. and definitely not only initial franchises, but each and everyone. But for them, special things is there that local marketing support will also be by PhysiQure.
And Anuvaji, any last comment from your side also on this?
So like we have explored a lot of things in the last 2 years. We now understand the basics, how to reach within the community, how to reach to every person next door. Because like I said, physiotherapy is relevant in a lot of conditions, but it's all about awareness. So now in any local market, we understand how to spread that awareness through any sort of community activities. Maybe they are awareness camps, they are consultations, from everything, from like normal banks have a seminar there to everything. So we have that ready, we have that model, we have worked it out. We are normally conducting every week, we are doing 2-3 activities which are community related to increase the awareness and so the input. So we'll be working that out again. We'll be helping the new people coming up with us also on that model, and I'm definitely sure it will help.
Great. Something technology support also to the franchisee.
Yes, I would like to answer that. Technology, entire CMS, entire software is our in-house. So technology is going to play an important role, from data management to continuous acquisition of the new customer to retaining of previous customer, feedback mechanism. Each and everything is with us with the help of technology.
Absolutely, that's very helpful, and I think the more we have a lot of prospects are already there in the system. So I think we will have one-on-one discussions on the day which is being appointed as an IFM day and discovery day. So my request to all the investors and all my partners, please filter it out. If you have any investor ready, bring him on the day which has been announced. So then that will be one-on-one discussion with the brand owners direct. If there is any possibility to have a physical meeting also, that is also possible, because then you can go and see the clinic itself. So that would be very, very helpful. So
most welcome to Bhopal, sir.
Absolutely. Thank you very much. And I'll invite again my colleague Archana to take it up now to summarize this thing. Thank you.
So thank you so much, Anubaji. It's really an inspiration for all of us. Thank you so much, Anandji. Thanks, Sanjay, for joining in today. Thanks all the dear participants for registration, joining us for this particular webinar. Yes, it's a big business opportunity for all of you. Still, you want to get more information, gather more guidance from our side on this business opportunity, you can connect with us at our business number, which is 97176-83838. Also write to us at feedback@franchiseindia.in. You can easily visit us at our different social handles. We are available at Facebook, Instagram, LinkedIn, and Twitter. Do connect with Gaurav sir and Sonia ma'am, the management team of Franchise India, at their LinkedIn IDs to get more information. And it's not only our everyday activity or pledge to provide maximum business opportunity through digital events, but we also organize physical events for all our investors. Tomorrow, we are inviting you to join us for our Patna show as well as Chandigarh show. It's a full day event where we have invited top business as well as their owners. So if you come from Patna or Chandigarh, please visit us for our respective physical events. And on Monday, we are bringing the brand which comes from the game vertical, Funplex Game Zone. We are launching on Monday at 12 p.m. To understand the journey and to know their business offering, you can join this webinar. Webinar can be joined by doing registration, and that can be done either by connecting with us at our business number or connect with us at our any of the social pages. Thank you once again for joining in today. Have a very safe day. Stay safe, stay healthy. Thank you so much.
Thank you very much, and best wishes to you.
Thank you everyone. Thanks from PhysiQure. We care to cure. Thank you.
Thank you so much. Thanks.